Welcome back to my channel, Pattern of Good Works. My name is Donna, and today we will be in the book titled The Specialty Practice of Rehabilitation Nursing, a Core Curriculum, the 8th edition. We will begin on page 178. On page number 178, under the header Technology and Equipment for ADLs and Mobility. And before we begin, ADL stands for what? Activities of Daily Living. So it says technology and equipment to facilitate safe ADLs and mobility are often incorporated into post-acute settings to promote optimum outcomes. So what are the rehab nurses trying to do? So we are trying to assist the patient with bathing, walking, toileting, transferring, eating, and dressing. Those are the activities of daily living. And we're trying to encourage self-care as much as possible. We want the patient to be independent, and that we should encourage them to do that safely. On page number 179, it says, after completing a functional assessment of the client's abilities and impairments, the occupational therapist determines his or her ability to complete ADLs and recommends specific pieces of adaptive equipment. So what is adaptive equipment, you may ask? Adaptive equipment is devices that facilitate a person's ability to complete daily tasks by compensating for impairments he or she has as a result of an injury or illness. So let's take a look at eating, the ADL of eating, the activity of daily living eating. It says eating is very personal and important for most clients in their efforts to be independent. And the adaptive equipment such as universal cuffs, plate guards, and adapted utensils, cups and plates can enable a person to feed himself or herself, but most clients need to have the equipment set up. So there is some setup assistance usually needed, and when patients are eating, having an individual, a CRRN, help to set up the item or the device for them is very helpful. For grooming tasks such as one's washing of the face or brushing of the teeth, adaptive grooming and hygiene tasks, one can use a spray deodorant. You can also use an electric razor or an electric toothbrush. And most people are not thinking that these are devices that are adaptive, but it helps to bear the burden so that an individual can complete that task independently. So always think of a one-handled toothpaste dispenser, a one-handled nail clip, and hands-free hair dryer. All of these devices help to have one perform their grooming task independently. For dressing, someone can use a dressing stick, a sock aid, a long-handled shoehorn, a button hook to help them to dress him or herself. And again, they may need some setup assistance or some supervision at time, but once given some time, they can complete the task. Toileting, some of the ADLs, which is very personal, but it allows the client to complete the task on their own. It could be a toilet aid. It could be a 3-in-1 commode. A drop arm commode is also able to be utilized. Patients can use, if they're spinal cord injured, they have the ability to self-catheterize. And to do this, they will use a leg spreader and a mirror. There are also bidets that can be purchased commercially for the home. That can help someone to become independent with their toileting. As far as bathing now, it says that bathing is an advanced self-care activity addressed by occupational therapists because the requirement for safe bathing are comparatively stringent with regard to strength, balance, endurance, and safety awareness. But some devices that can be utilized are transfer tub benches, shower chairs, long handle sponges, and bath mittens. We also see handheld shower devices as well as pump dispensers for shampoo and soap. Grab bars are also considered an adaptive equipment. Safety strips for the tub or the shower. And we can also see that on the floor. And also, these all help an individual to bathe safely. Although we have these in our homes, sometimes we don't necessarily think of them as adaptive equipment, but they are. And patients sometimes are given instructions during their therapy session, but they may not always remember that the device is to be applied this way, or they may forget the step 1, 2, 3, 4. So it's imperative that the CRRN nurse will remind the patient or the caregiver, as well as if they see something, I like to say, they'll say something. If you see the client or the patient applying this device incorrectly, share that information with the OT so that when they go back into their next session, they can go over this information over and over, because repetition will help this information to stick for this patient. So it's also imperative that if you hear them mentioning a fear that they may have, and one of the fears the book alludes to is that they will always have to use this device, so that if we can elicit that communication, have that open-ended communication with them, and hear them with their heart's desire say what may be concerning or what they may be fearful of. Hearing that and sharing with them, letting them know maybe you're just going to need this during your recovery period right now, during your convalescent period, but you may not always have to use that. But having that dialogue will go a long way, and it will also help the occupational therapy to plan out their sessions more effectively with each patient. Lastly, the book is talking on page 180 about mobility. It talks about safe mobility is an overarching goal for the client and all members of the healthcare team. Healthcare professionals, especially physical therapists, commonly identify assistive devices such as a cane, walker, as a way to promote safe independence with mobility. So a selection of assistive devices is based on the physical therapist findings, including examination, evaluation, and treatment goals as they relate to the functional outcomes. The client's cognition, their vestibular function, their judgment, their physical endurance, and strength are all factors that affect equipment decision. So a variety of adaptive equipment can be used to improve mobility, and it really depends on the client's needs. A gait belt can be fastened around the client's waist to help facilitate proper guarding technique and to help protect the client if he or she starts to fall or faint during movement. The client should wear a gait belt, according to the book, during all mobility and transfer activities. Again, you're going to follow your hospital or organization's policies and procedures. If a client has a feeding tube or other lines, placement of the gait belt must be adjusted higher or lower on the trunk to avoid occluding or pulling on the line. The book also mentions mechanical lifts. Remember that they are also called patient's lift, and they can be electrical or manual, which is a hydraulic and has a large, wide base C-shaped hoist to which a body sling that holds the client is attached. Again, you're going to go by your policy and your organization when you're actually using these devices to keep the patient safe. It says the mechanical lift is used for totally dependent clients. It is important to follow the weight limitations provided by the manufacturer. There are also another type of device, and they're mentioning here sliding boards, which we also call transfer boards, are devices to help move the patient or client from one surface to another, such as a chair to the bed or bed to the commode or car, are often used for clients who have a spinal cord injury or a lower extremity amputation. There are a variety of adaptive equipment for mobility that is also available. Some clients need lower extremity orthotics or braces to support a joint or replace an impaired muscle function for standing. And Ambulation. Devices to assist in ambulation include a single tip cane, a quad cane, which are used by clients who have impaired balance or need more stability. Remember that canes are useful on stairs or in confined spaces. When a client needs more support and stability, a walker is often used. There are a variety of walkers, such as those with wheels. There can be 2 or 4 wheels, those without wheels, and one-handed or hemiplegic walkers. There are also auxiliary crutches, which are used for clients needing less support or stability than a walker. It says there are also a forearm crutch and platform crutches that a PT might recommend depending on the client's needs and goals. And in this video, I'm going to try to include a variety of the devices that were mentioned so that you can see that all of these apparatuses help encourage the patient to become more and more independent. It says rehab nurses need to remember, again, several key things when helping a client use equipment or an assistive device to aid in mobility. Physical therapists select specific equipment based on the client's needs and therapy goals. Never hesitate to contact the client's physical therapist to discuss why he or she has recommended a specific device or for guidance on how to use the equipment with that client. Consult a PT to determine the client's understanding of the equipment and their ability to use the equipment safely, and alert the physical therapist if the equipment is not functioning as planned. So this week we had an opportunity to discuss the various technology and equipment that we can utilize to help patients to complete their activities of daily living, whether it's eating, grooming, toileting, walking, bathing. There is a device to assist them. I'm so grateful that we've now completed chapter number 10. We will continue on our journey into chapter 11. We are so grateful for your continued support. We're asking that you will like, comment, and subscribe. Wishing you all the best. Hope to see you next time. Take care. Bye-bye.